Hi, Joe Bonnier for FastPitchPower.com. In this video, I'm going to talk about post-physical therapy strength training for softball players, primarily for softball pitchers who have gone through physical therapy, possibly following surgery, specifically for an arm injury, shoulder, elbow, and wrist. I'm going to discard lower body and core exercises from this video. I've given you plenty of options to choose from in past videos in the 2014 off-season strength training program and beyond. Any of those exercises you can choose from, none of them compromise the upper body, so they're joint friendly. Choose which ones are appropriate and fit your facility or equipment availability. Right? I'm going to talk now about advanced strength training exercises that are going to transition you once you're discharged from physical therapy. That's important context here. You are an athlete, parent, coach who's been discharged from physical therapy. You're no longer eligible for treatment. You've been given a take-home program of isolated arm care exercises, right? But now you're looking for advanced strength training to transition you back to full strength or full speed on the field. Okay. So how do we select exercises? Which exercises are appropriate? Well, we want to progress to softball-specific demands. All right? We want to expose the individual muscles to the challenges that they'll endure during the sport-specific motions. Okay, so the different types of muscular actions. There are different types of muscular actions, different types of stress. So it's important that we choose exercises that gradually expose the individual muscles to that specific type of stress as it'll be needed on the softball field or in the pitching circle. We need to, most importantly, is challenge and improve muscular teamwork. So we need to use really exercises that involve multiple muscle groups and train those muscles as a team. Right? Because really that's what sport is and that's what movement is. It's muscles working together, not in isolation. So you can see now that the isolated arm care exercises, whether it's rotator cuff, scapula, core, they fulfilled their role. They did their job getting you pain-free, improving range of motion, getting you back to human function, but we need exceptional functioning in softball-specific performance and a body that's ready to endure those softball-specific demands. So let's talk about those demands. Let's talk about specific considerations regarding the windmill delivery and pitching sequence. All right? This is for fitness professionals and softball people alike. Let's just agree on terms and context. Arm's going to travel during the sequence. We'll use really general terms here. The 6 o'clock position, right? 3 o'clock position, 12 o'clock position, 9 o'clock position, back to the 6 o'clock position, back to the 3 o'clock position. Very general sequence here. What are the specific muscular actions, muscular responsibilities throughout that sequence? Okay. Most importantly, to recognize that there's a bunch of muscles working together. There is no one muscle responsible for stability here, for stability here, for stability here. Okay, for accelerating the arm and then decelerating the arm rapidly in the follow-through. No one muscle is important. They need to be trained as a team. We need to drill that into our heads. That we need to train muscular teamwork, but we need also, as I mentioned, we need to train specific muscular stress or specific muscular demand. What are the muscles doing in this position, whether it's early in the sequence or during follow-through? What are the muscles doing here as the arm travels from 12 o'clock as it approaches 9 o'clock? What are the muscles doing here as it travels from 9 o'clock to 6 o'clock into release? I can tell you that the majority of the time throughout the sequence, and to release, the muscles in the back of the shoulder and the shoulder complex are holding on for dear life. They're trying to keep the shoulder stable and compressed in the shoulder socket, or in the shoulder joint compressed. Right? Specifically, this is the best case example during follow-through. Well, once the ball is released, the muscles are going to be fully lengthened. They're going to be long, but they need to be strong. If they're not strong, what's going to happen? The shoulder's either going to end up in a very compromised position, okay, or, I mean, theoretically, this is theoretically, if you cut power to the shoulder joint, where would the arm go? Where would the hand go? It would fly away from the body. So those muscles are acting to decelerate, hold on, put on the brakes on that arm. It happens early in the delivery, okay? It happens midway through the delivery, and then it happens following release and delivery. Certainly, there's the muscles are acting to accelerate the arm as well. Okay, so the deltoids shoulder muscles are acting to accelerate the arm throughout the delivery, and then pec muscles, core, which are connected to core muscles and lat muscles, which all kind of interdigitate together as one team, are going to take the arm from 12 o'clock all the way through the release. So acceleration is important. That's about 25% of its responsibility. We need to train, put the arm in positions in which the responsibility of deceleration or compression is exposed or trained. Right? So holding the shoulder blade in a good position, the shoulder complex in a good position here, right? Preventing it from being pulled into an unstable position. Keeping the shoulder blade in shoulder complex in a good position here, preventing it from being pulled into an unstable position. Here, preventing it from being pulled into an unstable position. Okay? And I'll mention this briefly. Okay? What is a common technical fault in most young pitchers, maybe many pitchers, even successful ones, is getting the arm trapped behind the body here as they deliver the pitch. So instead of staying tall and vertically stacked and letting this arm just hinge in the scapular plane, which is absolutely the least stressful position for the shoulder, early rotation of the trunk or this forward as anterior weight shift, I don't know what you want to refer to it as, but maintaining their weight forward, traps the arm behind because the athlete has to keep it in this throw zone, but places the shoulder places a tremendous amount of stress, additional stress. Keyword is additional stress on the shoulder. There's a ton of stress. We know this from research, a ton of stress in the front of the shoulder from 9 o'clock all the way through the delivery. Okay? You don't want to add stress to the most stressful portion of the delivery. Right? And that's from that, whatever you want to call it, early rotation in this forward chest position, which leaves this front of the shoulder in a very bad position. So we need to figure out a way to either stay vertically stacked with optimal mechanics or improve the integrity of these muscles, okay, by resisting that extension behind our body or controlling extension behind our body. Hopefully I foreshadowed how we're going to choose exercises based on the requisite function of those muscles and muscular teams. All right? In this exercise, we need to train length. We need to challenge the muscles to be strong as they get long. Challenge the muscles to be strong as they get long in this position. Okay. Challenge the muscles to be strong as they get long here, and then challenge the muscles to get strong or be strong as they possibly are lengthened in this position. So, what exercises are going to challenge strength with good length and compression of the shoulder joint in this position? Rowing, okay, pull-ups and hanging variations, okay, and exercises that are going to challenge or at least challenge control as the arm gets pulled behind our body. As the arm gets pulled behind our body, pushing variations, and even some rowing variations. You can see the similar mechanics of the shoulder joint. It's important, I just should mention that all of those muscles or all of those exercises that we're going to be progressing toward fulfill both the deceleration demand and the acceleration demand as it relates to softball mechanics. Because like I said, we'll generalize and say 75% is keeping that shoulder in a good position. Compression and deceleration, 25% is acceleration through the throw zone. All right, there isn't one exercise that we're going to use that doesn't have some type of acceleration component, acceleration or concentric component to it. So you don't need to worry about dividing your exercise categories based on that. Right? The old school training exercises, rows, pull-ups, pressing, even overhead movements here, which challenge core and optimal shoulder organization, are extremely functional. So I'm going to demonstrate exercise that you can choose at the gym, okay? And hopefully you see the softball.